Welcome to Medically Speaking, a special 11-day Power Play edition. My guest today is Dr. Kara Kelly, the Program Director of Pediatric, Hematology, and Oncology at Oshai Children's Hospital and the Pediatric Chair at Roswell Park Comprehensive Care Center. Dr. Kelly, thanks for joining us today.
Thanks for having me.
So you are probably closest to the blood disorder program as the physician leader for that. Before we get into the 11-day Power Play activities and why it's so important to raise awareness and knowledge, if you can explain for our viewers who may not be familiar with the blood disorder program, what that is and how they treat their patients.
Sure. So we're really fortunate to have partnered Oshai Children's Hospital and Roswell Park in creating a joint program for children with cancer and blood disorders. It allows us to take the best of both. So all of the fantastic pediatric subspecialty care at Children's Hospital, where our inpatients are managed, and then all of the innovation and access to new therapies at Roswell Park, which is where our outpatient center is located. But as a program, we work very collaboratively together.
So obviously that's important in terms of collaboration and continuity of care. So was this something in the past that just wasn't as coordinated? They may have been working together, but not as closely, or were they working in silos at some point?
Yes, we've had a collaborative program for many years, but they were separate programs. There were separate inpatient and outpatient units at both hospitals. And unfortunately, what that meant is that there were certain services that we were not able to offer, especially bone marrow transplants for our youngest patients. And so before the joint program, we had almost 25% of our patients having to leave Western New York for therapies that were not available. By coming together and creating this joint program, those numbers have completely reversed. And today, very few children, less than 3 or 4%, have to leave this area for a service that we can't offer. And that's really a direct result of the joint program.
So that would be an obviously huge benefit for the parents and children who come through the program, quality of care improvements, things like that. Are there other benefits of having a collaborative program between, an institution like Children's Hospital as well as Roswell?
Right. No, absolutely. For, the example of a bone marrow transplant, that's a very, complicated, very serious type of therapy that we offer a subgroup of our patients. And so before, when we weren't able to transplant our youngest patients, they would have to go out of the area for months at a time. They'd be away from their other children, their other family members, and their care was often very discoordinated. So being able to stay here, to be able to be, in their homes, to be able to get the care locally, it results in better outcomes, better success with the treatment, and also, much improved quality of life.
That's obviously important for the patients and their families. If you can explain for the viewers, what are some of the types of oncology disorders that the program treats?
Sure. So our program, given that we are the only provider of pediatric hematology oncology care in Western New York, we see all of the different types of cancer and blood disorders, from the more common to the very rare cases. Overall, about a third of our patients have leukemia. About another 30% have brain tumors, and then the rest are a mixture of different types of cancers, that affect different organ systems. But we're really fortunate. We have a fantastic team of doctors and other providers that are experts in managing all of the different types of cancers that we see in the pediatric population.
If you can explain what type of support systems are in place along with the clinical treatment that goes on for the blood disorder program, what other things can families expect as they're going through something like this?
Sure. So, taking care of a child with cancer really requires multidisciplinary care, and where, we have a very comprehensive team, and many of our physicians are not only recognized locally, but they're national and international experts in specific types of cancers. Our nurses are specialty trained. This is all they take care of. They know how to manage administration of chemotherapy, they know how to support children through bone marrow transplants. We have psychologists, child life specialists, social workers, and other support, personnel that really attend to the whole body, the whole family, because it's a really such a difficult experience for these families. So having all of these supports not only improves quality of life, but results in better outcomes.
You've been a leader in pediatric oncology for quite some time. Can you explain some of the advances that you've seen, whether it's here in Buffalo or by having both Roswell and Children's work together? What are some of the benefits of that, and what are some of the advances that you've been able to see and shepherd here in Buffalo?
Sure. So, it's a incredibly exciting time in cancer treatment these days. Although in pediatric cancer, we have been successful, and to date, we cure almost 80% of all children that we see. Some subtypes, such as acute leukemia, that number is over 90%. But one of the challenges is that we use pretty toxic medications that not only cause side effects in the short term, but also in the long term. So really over the last 5 to 10 years, there's been more of a switch to immunotherapies and more targeted therapies. We are now doing testing the genetics of the tumor, and we're able to match specific drugs to that. Here in Western New York, we've been able to build through a collaboration with Roswell a really robust cellular therapies program. One case that we're, just really exemplifies what we have to offer is that we used a form of a novel cellular therapy that was engineered to specifically target a very young infant's leukemia, a very aggressive type of leukemia that had not responded to standard therapy. And this child was treated, was managed at Children's Hospital, went into remission, subsequently underwent a bone marrow transplant. And she's now, over a year and a half, almost 2 years out from her transplant. And this type of novel therapy is something that we could not have done just 3 or 4 years ago before the joint program came together. So, we have a great team of physicians and other staff, nurses, the whole team to support the child and the family. And we also have access to the really latest and greatest, therapies that result in higher cure rates and much less toxicity from the treatments that we used in the past.
That's great to hear. And you can obviously hear the excitement in your voice about the availability of, technology and resources and treatments. And there is a reason, I'm sure, to be upbeat about all that. But you're dealing with a very difficult issue when it comes to pediatric oncology or a cancer diagnosis. As you are dealing with families in those initial days, what's your message when you meet with that family for the first time, or as they go through that initial treatment, or when they know they're going to be in this, joint venture between Roswell Park and Children's Hospital?
Or, the messages are, we're here for you. We have a whole team to help support the child and the family. And even more importantly is that we have, the best treatments for children with cancer today. You don't have to leave Western New York. You don't have to travel. We have the latest therapies, and now patients are coming to our center from outside of Western New York to access these treatments that are not available anywhere else. So it's, I want people to know that, we have really, great treatments, great team, and they're in great hands with all of us here through this joint program.
You mentioned support for the program. We would be remiss if we didn't talk about the 11-day power play, a unique event to say the least, but something that really can help a program like yours. If you can, why is that event so important? Why is raising funds for the program so important?
We're so appreciative to the 11-day power play for their support of the pediatric program. They've been supporting the nurse education and training for our bone marrow transplant program. And that's really allowed us to expand not only the total number of children that are transplanted here, but also all the different types of conditions that we can transplant, which was something that we never did before in this area. So we are really just so grateful for that support. It's really making a difference. Every dollar helps. We've made such progress, but there is so much more. We won't be satisfied until every child is either cured of cancer or we figure out a way to prevent it from happening in the beginning. And it's a really exciting time with research, and lots of new therapies are coming down the pipeline. And through that support, it allows us to get them faster to the children and the families that need it the most.
Well, Dr. Kelly, thanks for using the term team, because the 11-day power play could not exist without a team effort with the players and sponsors, but also it's a team that wants to help your team in particular in both Roswell Park as well as Oshai Children's Hospital. Thanks for joining us today on Medically Speaking.
Thank you.